This analysis will discuss the issue of period poverty and how this global feminist issue affects menstruating people worldwide. Period poverty is described as the inaccessibility to menstrual health products, hygienic facilities, waste management, and education surrounding menstrual health. On average, menstruating people experience 45 to 60 days per year of vaginal bleeding, during which menstrual hygiene products like tampons, pads, and menstrual cups are used. These products allow menstruating people to continue their daily activities, such as work, school, parenting, etc. However, for more than 500 million menstruating people worldwide, access to these products, along with safe hygienic facilities and waste management for changing and disposing of products, is out of reach. Globalization and capitalism affect these people across different nations, races, classes, and genders, making this a transnational feminist issue. BIPOC communities are disproportionately affected, as intersectionality is a significant factor in who experiences period poverty. A 2025 report shows BIPOC women in low socioeconomic classes are 23 to 24% directly impacted by period poverty, while 8% of white women were directly affected. These numbers represent the disproportionate impact of poverty on BIPOC communities, and consequently, the impact of period poverty in these communities. Hierarchical systems are a reason for these unjust disparities as they work to oppress marginalized groups in all social forms. Statistically, these outcomes affect BIPOC women at higher rates, leading to lower achieving women in society, which can have negative consequences for BIPOC communities and perpetuate poverty, leading to harmful stereotypes about these communities, making this an intersectional feminist issue. When examining the epidemic of period poverty, it's important to ask yourself, what is the root cause? Factors including environmental causes, economic vulnerability, taxation, and lack of education and cultural stigmatization around menstruation are all contributors to this issue. In Nepal, for example, cultural ideologies believe that using a tampon will cause a woman to lose her virginity, and during menstruation, women are forbidden to handle any food as they think it will spoil, making it inedible. This form of sexism has significant impacts on women's mental health as they're conditioned to believe their bodies are dangerous and will cause harm. Stigmatization around periods persists in many cultural and religious ideologies, leaving women within these communities often shunned and isolated during their periods. So why is this a feminist issue? Prioritization of women's healthcare has constantly been neglected. Hierarchical systems don't want powerful women. Shaming biological functions of the female body. The need for educating young girls about their bodies is missing from our discourse. Period poverty is a form of oppression. Pink tax only applies to products for women, including menstrual products. Vaginal health issues like bacteria infections, UTIs, and in some cases, toxic shock syndrome. Some reports have found women choosing pregnancy over their period to avoid the hassle and stress. Mental health issues are a significant concern for women experiencing period poverty. Anxiety and depression were reported among other forms of mental health disorders. Mental and physical health concerns surrounding women are exactly why this is a feminist issue. Okay, this is a feminist issue, but why is it important? Period poverty creates a cyclical pattern where women and girls constantly miss school and work due to inadequate menstrual health, and as a result, perform poorly in those areas. These outcomes lead to women receiving a lesser education or foregoing their career compared to a woman with positive menstrual health who is able to pursue her endeavors. Period poverty is a global human rights issue and is exacerbated by patriarchal structures, policymaking, and hegemonic dominance over what bodies are valued in the medical society. This form of female oppression has social, cultural, economic, and political consequences. It requires social change, policy reform, and a serious evaluation of women's health to address the impact of the period poverty epidemic. So how can you get involved? The Alliance for Period Supplies is working on ending period poverty. They work with over 100 period supply banks to address period poverty in communities across the country. Here are ways they suggest that you can help right now. One recommendation is to track period legislation. Every year, bills are introduced to help end period poverty and achieve menstrual equality. Many bills are introduced, but few end up becoming law. Follow these bills and know which ones to vote on. Their tampon tax toolkit will help you identify which bills to follow and even provide you with a template to write to your legislators. Hosting a donation drive is another great way to get involved. Volunteering with local organizations that focus on ending period poverty is another great suggestion, as well as fundraising in your local community. Organizations like the Alliance for Period Supplies give us hope for the future. But they're not alone. Dignity Grows is an organization that's leading the fight against period poverty through direct product support, vibrant partnerships, and data-driven social policy change. In October, they hosted their second annual National Summit on Period Poverty, where they brought together professionals from 23 states to raise awareness and explore solutions for this global issue. No More Secrets is a Black women-founded organization that started the nation's first menstrual hub and uterine wellness center, the SPOT Period. Their mission is to decrease menstrual health disparities in underserved communities through the eradication of societal stigmas and propagation of resources and scientifically based information. Understanding policy around period poverty is important for tackling this issue, and the Alliance for Period Supplies comprised a tampon tax toolkit with the purpose to provide the tools and resources to help interested individuals like you advocate to ensure period products are affordable and taxed as basic necessities in your area. Their mission is to challenge the systemic barriers that prevent access to affordable menstrual products while advocating for policies that promote menstrual equity. Period poverty is a gender injustice and is experienced on a macro social level, leaving women and girls disproportionately affected by a biological function of the female body. Period poverty requires social change, policy reform, and a serious evaluation of women's health. Menstruation is nothing to be ashamed of, yet androcentric structures have controlled the language and discourse around menstruation in women's bodies, ensuring that half the population remains marginalized by their own biology. Period poverty is a feminist and human rights issue that requires immediate action. We can challenge these systems by contacting local legislators, advocating for free menstrual products in schools and workplaces, and organizing community donation drives. These efforts work to eliminate period stigma and advance equality in women's health and bodily autonomy.